Hello and welcome to this week's edition of Health Talk. Level 4 lockdown regulations kicked in, as was announced by President Cyril Ramaphosa during the week. However, some restrictions still remain as to what citizens can and cannot do. And furthermore, some leisure and social activities will remain prohibited through the lockdown level. Here are 10 things that you need to know about level 4 lockdown. So you got to wear cloth masks. That's now compulsory. There's a curfew between 8 p.m. and 5 a.m. each day. No alcohol and cigarettes are allowed to be sold. Outside exercise allowed between 6 a.m. and 9 a.m. in the morning. Businesses are to operate but still no public gatherings are allowed. Food delivery from 9 a.m. to 7 p.m. No takeaways, no sit-downs. So you can call on your online services for that and they'll deliver. Limited public transport will be allowed. I think some of the trains will be moving. Gautrain, I know for sure. Vehicle recovery services will be allowed as well. And no international travel, and I think domestic travel as well, is actually not allowed. Now, on the program today, we take a look at how ready provinces are and what plans they have in store for citizens. For that, we'll be joined by the health MECs from the provinces of KwaZulu-Natal, Mpumalanga, the Northwest and Limpopo. We'll also be crossing to our reporters in these provinces to give us a sense of the situation down there. So that's what's coming up on the program. But remember, you can be part of the show by asking our guests some questions that you might have on your mind, or you could just simply share your views on some of the issues that we're discussing today. And the number that you need to call is Johannesburg 011 714 5861 or 5877. So that's 714 Johannesburg 5861 or 5877. And just to let you know that our question of the day today is what are some of the challenges your community has been facing during the lockdown, and which regulations would you like to see amended and how? And you can send us your voice notes or video calls via our WhatsApp line, and that's +27 65 862 4548. All right, so it's +27 65 862 4548. And you can also share your thoughts with us on social media, and that's via Twitter using @SABC Health Talk, or on our Facebook page, SABC Health Talk. I'm Peter Ndoro, and Health Talk starts right after this. Welcome back. You're watching Health Talk. Now, police in Durban are out in their numbers as the city joins the country in starting day 2 of the level 4 lockdown. And to talk to us about some of the issues in the province, we're now joined via Skype by the KwaZulu-Natal Health MEC, Namagugu Simelane Zulu. Thanks so much indeed for joining us, and welcome to the program.
Good morning, Peter, and good morning to your viewers.
All right, so MEC, it's day 2 of level 4. Do you think that the province is ready for level 4, given what you've seen during level 5?
Well, the province, Peter, is certainly ready for level 4, although there are areas within the province that we might at some point look, depending on how the community itself is behaving, consider requesting the president and the minister to take back to level 5. At eThekwini Metro in particular, we are a bit worried about the movement of our people there in particular, and we are really keeping a very close eye on what happens in the next few days, so that in about a week or so, if it's necessary for us to reassess, and that is a recommendation that we are going to be taking back to President and the National Minister.
Is it a concern for you this week that ends on the 7th with this interprovincial movement that's going to take place, that this might bring the virus to your province?
It's certainly a worry, and it's a risk. It is a risk that is there. However, what we have decided to do is to ensure that in every or on every road that is a border where we are sharing a border with the provinces and even the outside borders, we are strengthening our visibility there. We are strengthening our processes of testing and of screening and testing. We are also going to be putting up our mobile units towards those roads so that we ensure that no one comes in who might actually have the particular virus. So we really are concerned with that. However, because we understand that people might have to go to work and they were locked down in areas that they don't work in. It's a risk that we are going to have to take, but we are calling on our people not to move unless it's really necessary for them to do that. We have a few mobile labs that we have been given by the national government, and some have been donated by our partners. So those are the ones that we are going to be utilizing in the different borders. We share a border with Free State. We share a border with Mpumalanga in 2 or so areas. We share a border with the Eastern Cape. Of course, we share a border with Swaziland and Mozambique. So those are the areas that for now, for the next couple of days, we are going to be focusing on, besides the work that we are doing in eThekwini.
MEC, at the beginning of this conversation, we talked a little bit about compliance, and I'm just wondering, is it defiance? Is it ignorance? A lack of understanding? Why is it, do you think, that in some areas people just don't seem to be giving this the seriousness that it deserves?
Look, the likelihood is that it has not really sunk into our people the seriousness of this particular virus. I mean, you know how we are, you know how South Africa is about making jokes of everything. When you go on social media, almost every single thing is a joke. And when you listen really attentively to those jokes, you just pick up really between the lines that people are not thinking this matter is serious. Some of them will still tell you that they've not seen anyone who has suffered with this virus. Therefore, they don't think the virus exists. They think it's propaganda that is being given by government. So it is that kind of I think sometimes it becomes mob mentality, which is really worrying. However, we have begun to strengthen our communications with our people through our radios, the ordinary radio stations, but the community radio stations as well. And we are looking at other alternative ways of communicating with our people, considering that we can't have gatherings, we can't go and speak to them en masse. It means we need to start thinking outside the box. And right now we are working on a number of things or ways of communicating, including the media, including print media, including sketches that we are going to be putting up both on TV, on the different radio stations. So it is a serious worry that our people have not really begun to take this virus seriously. And if it continues like this, that is what is going to be our downfall.
All right, so at the beginning of this virus story in South Africa, KwaZulu-Natal was pretty much the epicenter of the disease, particularly in terms of fatalities. The Western Cape seems to have taken that, but you're a close second. And I just wonder, is it that Western Cape are testing much, much more than KZN, and that maybe once you ramp up your tests even more, that could shift once again to KwaZulu-Natal being quite vulnerable in terms of the figures that have been coming through?
Well, at this point, we are not sure on what the reasons are. We are looking at them. I must indicate, Peter, that even though we are seen to be number 2, we are not relaxing at all. We are continuing with our work. Look, even when you look at the number of deaths, right now there's a theory out there that says for every death, there is 100 people that are infected. Now, which means when you look at our numbers, we are on 32 deaths. It means we should be at about 3,200 people that are infected. But when you look at the number,
Yes, carry on.
okay, when you look
Yeah.
at the numbers of the deaths in the Western Cape, they are still very, very far ahead of us. So it still means even if we ramp up our screening and testing, they will still be ahead. Having said that, we have decided, Peter, particularly in eThekwini and those highly dense areas of population, that we need to get ahead of the virus, and the only way of doing that is to ensure that we are tightening our testing and screening in those areas. In eThekwini, Peter, we have decided that we are going to be literally testing everyone because it is our economic hub, but it's also an epicenter for the province in relation to the virus. So right now we are testing everyone. When you look at the numbers that we have tested so far in at least 1 week, we have tested, in a week, we've tested 500,000 people in the province. So, but when you look at everyone and when you look at the dates in the past 2 weeks, we are now on 1.6 million. So we are really focusing on the testing because we do want to find the virus. We do want to be actively finding the virus and don't wait for people to come and present themselves in our facilities. So we want to go and get the virus wherever it is so that we can be able to cut the transmission. So at this point, really, there's nothing scientific that we can give you to say these are the reasons, but we are not looking at ourselves as number two at all. We are working as if we are an epicenter because we have a responsibility of finding everyone and making sure that those that are infected are treated, but they are able to sit at home, or we put them in a facility so that we are able to cut the transmission.
All right, MEC, I'm going to ask you just to hold on for a second. I'm going to talk to our reporter on the streets in KwaZulu-Natal, and we might get some questions from viewers. So if you could just hold on for a couple of more minutes, because we're now joined by reporter Vusi Kumalo, who's out in the streets there to get a sense of what's happening on the ground. Vusi, thanks very much indeed for joining us. I see a lot of people behind you. Where are you, and does it look like that social distancing is being in play, and where are these people going? Are they shopping? What's the story?
Yes, good morning, Peter, as well as to the viewers. I am here at Sipingo. It's just a few kilometers away from the Durban metropolitan area, from the city of Durban. This is where you find a lot of people, most of them coming from nearby townships such as Umlazi, where the largest part of Umlazi, which is adjacent to the Espingo, most of those people are shopping here, even though there are some shopping malls and shopping centers around Umlazi, but most of them choose to come to this town called Isipingo. This is where also you find people coming from areas such as Adams Mission, Kwamakuta, as well as other areas. Well, today, as being on Saturday, the 2nd of May, we are seeing quite a lot of people here. Maybe if I can step out of the shot so that you can have a clear view of the people, whereby in every corner of the streets here, you find a long snacking queue of people going towards the major supermarkets that are here. This is where you also find most of these supermarkets are selling their items or products in not so expensive prices. So that's why people, most of them coming from these nearby townships, usually find shopping in this area very, very easy. So I've been speaking to some of them. They are saying that they've been experiencing some challenges here. I must say that also, while it is very impressive to see most of them are wearing their face mask, and most of them have done away with the gloves, but some are saying there are supermarkets which are denying them an access or an entry to the shop due to the fact that they are only wearing scarves. So these people are saying that these shops only allow people who are wearing only masks. So they are saying that those are some of the challenges that are that are being experienced, especially in this town of Isipingo. But I must say that there's quite a number of people whereby the social distancing is not being maintained. That's 1 meter or 2 of social distancing. Well, I must also indicate that we were here early on in the week, whereby also the numbers were the same. It seems as if social distancing is not being maintained by the shoppers around here. We've spoken to a number of them. They are saying they are also concerned, but they're saying there's no other way. They cannot access these, the shops that are around here at the Sipingo area.
All right, so Vusi, we're going to leave it there for the time being. We've got a caller on the line, and I believe it's Jenny in the Western Cape who has a question for the Minister at MEC. Thanks so much indeed for joining us on the program, Jenny. What's your question? Hello, Jenny, can you hear me? Hello, Jenny, are you there? All right, it looks like... Hello, Jenny, can you hear me?
Yes.
Hi, Jenny. Right, what's your question?
Hi, good day, sir. My concern would be we are smokers here in the Western Cape. We all smoke around here in the Cape. And our concern is when we need to buy cigarettes, they're taking the ban away and we have to buy cigarettes on the black market. And we unfortunately can't get the brand that we get, so we've got to take any kind of cigarettes we get, which is not good for our health. You know, this is going to kill us faster than what the virus is going to be.
Yeah, and I can
and
imagine...
we would like to know they could maybe just lift the ban on the cigarettes, you know.
And I can imagine that it's really difficult for somebody who's a regular smoker just to stop.
That's the problem, sir.
All right, okay, let's put that question to the MEC, who I hope has been listening. MEC, a lot of smokers, some of them smoking a lot every single day. It's impossible for them to just stop overnight. They're saying, can you not relax the rules for cigarettes because they're being forced onto the black market, and we know that black market products not always safe?
Peter, firstly, the issue of regulations is a national competency, so that would be the minister and the president and all the other ministers. Having said that, and if you want a regulation to be removed or suspended, those are the people to talk to. Having said that, though, I think it's very unfortunate that our people don't realize that this ban is actually in their own interest. Peter, it would be very irresponsible for government to lift a ban on cigarettes when cigarettes are about your lungs, your breathing, when we are faced with a virus that actually firstly attacks your respiratory system. It just would really be extremely irresponsible. That is why you found that initially there was an indication that a ban will be lifted, but on thorough discussions and consultation, the national government then also decided that no, we can't lift the ban, it must still stay on, because one of the first symptoms of this virus is the shortness of breath, which means the virus attacks your respiratory system. So this is in the interest of the people, and we are really calling on the people to adhere to this regulation, because this is what is going to assist them, but this is what is assisting all of us to curb the spread of this particular virus. So even if our government only just needs a partnership with the communities, with our people for a short while, so that we make sure that this goes away. And as soon as the virus is no longer a threat to all of us, I'm certain that government will be able to go back to the ordinary rules. But just for now, and in the interest of all of us, in the interest of our people, let's really adhere to the regulations that are there. I know that they are going to black market. Oh, that on its own is something that is putting their own lives at risk, Peter.
Okay. MEC, thanks so much indeed for joining us, and we certainly wish you the best of luck and strength as we get into this next level. Let's hope that our citizens comply and help with each other to fight this virus. Thanks so much indeed for your time.
Thank you very much, Peter. We appreciate the time.
All right, so that's the Health MEC in KwaZulu-Natal, Namagugu Simelani Zulu, speaking to us from KZN. We're going to take a quick break, and after that, we continue with our discussion with the Northwest Health MEC, Madoda Sambata, and also our reporter on the ground there is Tebogo Pagedi. Welcome back. You're watching Health Talk. Now, all confirmed COVID-19 patients and their contacts will be put under supervision to avoid spreading the virus. That's according to the Northwest Department of Health. To understand why this decision has been made, we'll be crossing now to the Northwest, where our reporter Tebogo Pagedi is standing by with the MEC in the province, just to get a sense of what some of the challenges and issues are on the province there. Tebogo, thanks so much indeed for joining us. I see a lot of people behind you, and I'm just wondering, do you get a sense from what you've seen today that people are adhering to the level 4 regulations so far?
Thank you very much, Peter, and of course, good morning to the viewers. We are in Mahikeng CBD at the moment, and I can tell you, Peter, just by observing the people who are present now, people who are here at the CBD, it looks like it is a normal day, looking at the long queues, and as you have mentioned, you can see behind me, there is a queue of people who are coming to a store who are here to buy essentials. And I can also mention that even taxis will be operating for the full day today. And of course, if you can just look at the stats, Northwest Province has registered 35 COVID-19 cases up to so far, with 20 recoveries. And of course, this leaves us to 15 active cases. And Peter, I can attest to the fact that this really looks like a normal day in Mahikeng, and as much as we are on day 2 of level 4 of this lockdown, for some this is an opportunity to go to different stores to buy what they can. And as we drove here this morning, we did not see any people jogging. What we saw were people who were going to different stores, and we did take some time to check what are some of the stores selling and so forth. In terms of those who are selling food, and of course you'd know that majority of the items that are sold there are essentials. In terms of shops that are, or stores that are selling clothes, we were told that they are only selling winter clothes. As far as the furniture shops, they're only selling laptop, kettles, and of course heaters. But to talk more about this, I have with me guests who will clarify and explain further their challenges. Thank you very much, Ozinel. Here is Dineo Mwakezi. You can just tell us, we are on day 2 of level 4 of the lockdown. Just tell us about your opinion, or what is your take on the ease of these lockdown regulations, especially now we're looking at the fact that some activities are allowed.
Thank you, Tebu. I think, and it's my personal opinion, that we should have continued to be on lockdown for the fact that the regulations that we had were not even restricting us to come to town and buy the essentials. Therefore, I think the people's lives comes first, and it's up to government also to assist us in terms of, maybe it's best if we were in level 5, in a sense that even if there were regulations, we still had people to come and buy. We can still go to town. It's not like we were locked to an extent that you can't go anywhere, no, do anything. But for now, it's scary in Mahikeng, in a sense that everyone is everywhere. So it's a challenge that even the people that we are saying, they are the poor of the poorest. They don't have the masks, they don't have access to the masks, of which it is also a challenge that the COVID-19, chances are it will spread as compared to level 5. Thank you.
Now, speaking of wishing that we were still on level 5, were there some of the challenges that you were facing as far as the regulations?
Not necessarily. There were no serious challenges per se, in a sense that the aged when they were sick, they were allowed to go. The regulations were not that stringent. It's just that there were proper coordination and proper monitoring of people. At level 4, it's very difficult to monitor people. Therefore, hence I am saying the spread of the virus, chances are they are going to be very high at level 4.
Peter, that is Dino Mongwake is explaining that the country should have really remained on level 5. And I can tell you that there are some of the residents here who do not have their masks on. There are some of them who do have their masks, but they are not putting them on properly. But to also talk about the issue of health facilities, I will be talking to other a guest of mine, that is Tato Taha. Tato, thank you very much for talking to us. Just tell us about some of the health facilities. Was there a challenge accessing health facilities during the lockdown?
Thank you, Tebo. I personally have not gone to a health facility, but I have a relative who visited a health facility, and he felt very vulnerable, and it was very challenging because he had to sit very long in a queue. He actually arrived at 8, and it was until 5. The queues were long, and he felt that he's actually more exposed to the virus sitting in the queue as opposed to if he was at home.
Now let's talk about the issue of regulations. There are some people who are saying it is a challenge for us to adhere to these regulations because of this and this and that. Did you also have challenges adhering to these regulations?
It was a bit challenging, but I tried. But I think my biggest fear was the community, the larger community around me. I find that people do not actually adhere to the regulations. People do not observe social distancing. Even if you feel that you are protecting yourself, people around you then put you at risk because they are fighting authorities. If you get into a store, if the authorities want to sanitize you, people don't want the sanitizers. People do not observe social distancing. So that to me is a threat. I feel vulnerable.
Okay. Thank you very much for that. We are told now to just talk to the MEC. If MEC can just approach us, if MEC can just approach us so that we can just talk to the MEC of Health in the Northwest Province, that is MEC Madoda Sambata. MEC, thank you very much for talking to us. As we've heard to people explaining that indeed this is a concern. People are all over the place in Mahikeng. Some of the people are not adhering to the regulations. As we all know that up to so far more than 10,000 people have been arrested in the province. Let us talk as the department. What is it that the department is doing to understand, to make sure people understand these regulations?
The Department of Health in Northwest is highly disappointed with how our people are treating level 4 of lockdown, because the president never said the lockdown is gone. We are in level 4 but still in lockdown. Our people are loitering around the town to an extent that we are worried about the implications of what they are doing, because social distance in COVID-19 prevention is very critical. And yet in town, people are just moving around as if lockdown is no longer applicable, as it is lockdown level 4. So as a province, we are in constant communication with the Disaster Management Center, talking with police, talking with South African National Defence Force on the responsibilities of them enforcing compliance to lockdown regulations, which part of them, it's social distance whenever people are out in town. South Africans must take the issue and the call of the nation to remain in a lockdown, remain properly complying, so that we don't have a situation where numbers would then overheat to a level where the nation is unable to handle the matter. And it is only through our contribution as individuals to ensure that we keep rules of the lockdown in place, respect them, and we conclude that we are going to make sure that each one of us contribute in flattening the curve of the infections.
MEC, speaking of flattening the curve, we know that the province has rolled out testing and screening of people, but we do have people like Deborah Moses, for example, saying from where they live, they have not seen any testing taking place. If you can just tell us about that.
We must tell South Africans that the province, based on the national instruction that we must do screening and mobile testing. Currently, as we speak, we have screened 1.1 million people in Northwest out of total of 4 million. 1.1 million have been screened. In that 1.1 million, 2,540 have been tested. In that test of 2,540, up to today, 35 have been detected to be positive. Moses and other members of community who are residents of the province should understand that there's a schedule of where screening is going on each day. So each district has its own schedule, each sub-district has its own schedule. That screening has not yet arrived in his township or rural communal area. He must just link up with the officials of his district to be told of the schedule, because we have a schedule as a Department of Health that now starts from this month and it's going to end up in September at the end. We have decided to have a schedule of screening ending in September because we do not want to lower the guard on readiness and preparedness of our people. So each community has its own date where health officials are going to arrive on them.
Thank you very much. That was MEC Madoda Sambata, the Health MEC for the Department of Health in the Northwest. And of course, explaining that testing is going to enroll and further enroll as they have already started, with the province having registered 35 positive cases. And of course, Peter, this is the stance in the Northwest. As you can see, a lot of people are here in different stores making sure that they purchase what they deemed to be needing at this moment. But for me, back to you in studio.
Teboho, thanks so much indeed. That's our reporter, Teboho Pachedi. We're going to have to leave it there for the time being. In the Northwest, we still have 2 other provinces that we're going to be visiting. And in fact, run after the break, we will be doing that. But first, don't forget, our question of the day today is, what are some of the challenges your community has been facing during the lockdown, and which regulations would you like to see amended and how? I know that there's one caller already from the Western Cape who'd love to have the cigarette ban lifted. You can call us on our WhatsApp line and send your voice notes or video notes on +27 65 862 4548. That's +27 65 862 4548. And you can also share your thoughts with us on our social media pages. That's via Twitter using @SABC Health Talk, or on our Facebook page, which is simply SABC Health Talk. After the break, we continue with our look at the provinces, and we go to Mpumalanga, where we'll be joined by Health MEC Sasekani Manzini and SABC reporter Tumela Machoho. Stay with us. Welcome back. You're watching Health Talk, and we've been going around the provinces, catching up with our MECs just to get a sense of how ready they are. And we'd love to also hear from you. You've been sending your messages to us via social media, particularly Twitter. Let's take a look at some of those messages now. And these are some of the thoughts that you've been wanting to share. Freddie says, SABC Health Talk, I'm in Mabalstad village, and a lack of water is a major challenge. And I thought that we'd be supplied with water tanks during the lockdown period like other places, but nothing positive has happened so far. All right, a very concerned citizen there. Balasti says, good morning. The challenges that we see at Pretoria Sunnyside, we don't see people coming into the flats to test tenants. People are also walking to shops without wearing masks, which is mandatory on stage 4. Amend regulations to not allow customers entering in a shop without a mask. Okay, that's a good idea. Very good point. Sia Bui says, I'd like travel restrictions between work and place and home amended. I work at about 363 kilometers away from home in the same province, and during my off days, I'd love to see my family. besides screening can be done at a point of entry at all districts. Okay, thanks very much indeed, Siaboy, for your message, and all of you. In fact, there's one more. In fact, that was the last one. Okay, so that's your messages. And don't forget, we still want to hear from you, so you can continue to communicate with us. But let's continue with our journey across our provinces and get a sense of what's happening on the ground. And as a precautionary measure to ensure that there'll be enough isolation areas to treat patients with COVID-19 in Mpumalanga, 5 secluded rest camps in provincial game parks have been prepared for a possible bigger onslaught. And talking to us with regards to this, I'm now joined by Mpumalanga's Health MEC, Sasekani Manzini. Thanks so much indeed for joining us, and welcome to the program.
Good morning, Peter, and at home.
All right, tell us a little bit more about these campsites and what you're hoping they'll do. What are you planning for?
As a province, immediately after we had the first case in the country, we also started to establish quarantine areas and also isolation in the province where we identified Rob Ferrer. But as we move towards the different stages, we also further identify the different districts so that we don't have too much movement, so that we do have in all our 3 districts, we do have areas in your game reserve, in your boarding schools that we are having in a province, and also private areas that we have identified in the province. We can say that we are ready as a province, and also we have identified those hospitals that are not fully utilized so that we can designate them specifically for COVID-19. So you're correct. As a province, we can say that we are ready in terms of making sure that our people are safely quarantined and isolated.
All right, we've spoken to a couple of MECs already today, and one of the consistent issues that's coming through is that citizens, some of them are just not complying with regulations. Has that been your experience in Mpumalanga as well?
We are working with the SAPS and SANDF in the province. We can also indicate that most of the time movement started when they were getting their social grant and people going to say we are going to buy food and all that. It is a challenge also in the province, and the issue of social distance. But the Premier has led a team where different MEC will always make sure that also with the involvement of the municipalities in the different areas, they are assisting us a lot. But of course, we still calling on our people to say they must adhere to the regulations, because it is of our best interest, all of us, to make sure that our people are safe in the province.
I believe that you're employing everything possible to fight this virus, including technology. Talk to us a little bit about this collaboration between your department and Tech Solutions Group Broadreach to roll out COVID-19 community screening on a mobile app.
Yes, you have seen the Premier launching the app in the province. That app is assisting us in terms of making sure that those community healthcare workers, when they are on a daily basis doing their door-to-door, they can put on the app, will be able to see where to focus as a province. And also, over and above that, we have used our web as a department so that some of the people who can use their own devices, they can self-screen themselves. And that is going very well. As a province, hence, we are seeing many people who are able, also more than 9,000 people have used that self-screening, and it's assisting us as a province, and we have identified one out of that process that has been tested. So it's a good thing that we must not wait for the door-to-door. Hence, we're always saying to our members of the community in the province that if you feel like you're having some symptoms, you don't wait for the door-to-door, because all our clinics, all our hospitals are open. You can visit your nearest clinic, so that because we have also a triaging process in that area where everyone that comes to our facility, we are screening. So the screening is happening almost everywhere, so that we are able to get as many people as possible.
That's where we're going to have to leave it today, but thanks so much indeed for joining us, and we wish you and the people of Mpumalanga the very best in fighting COVID-19. Thanks so much for your time.
Thank you, Peter, and to the viewers.
Thank you. All right, that was the MEC for Health in Mpumalanga, Sasekane Manzini. All right, our reporter Tumelo Machocho is on the streets there in Mpumalanga. Let's catch up with him, find out where he is and what the situation is on the ground. Tumelo, thanks so much indeed. We've been to KZN and to the northwest, and they were a bit busier than where you are. Is it a quiet day? Is it a usual day? Saturday, payday, people should be shopping in their numbers.
Well, Peter, indeed, we're in Mbombela, in the Just City Center here in Mpumalanga. The people is busy as normal. People are going in with their lives, going in to go and shop. Some are just here in town, actually doing some businesses here in town. We've seen people coming in and out of stores with groceries, with an essential product that they might need in their homes, because you'd remember that most people are already paid. They got paid on over the week, and then now it's a weekend. People want to be out, and then they also want to be out and start shopping for their groceries. But most people here in town that we have actually observed, they're all wearing masks, which is an important thing, because no one is not allowed to go out without a mask, since President Cyril Ramaphosa said everyone must wear a mask when they go into the public. But we've seen a lot of people actually wearing masks, but the town is still busy and people are still not practicing social distancing. We've been seeing people queuing at banks, at ATMs, trying to withdraw money there. And Peter, we've been seeing people actually standing very close to each other. We've seen shops actually trying to limit the number of people that can go into the shops, but at the ATMs there's not really people or security to make sure that people actually practice some social distancing. It's very busy. You can see people are walking around. It's just like a normal day here in Mbombela. People are just walking around. It's so busy even here in town. Cars are everywhere, so people are actually out in numbers to actually just go out with their businesses. But let's speak to people, because you know they are happy that some of them are happy that the regulation have been relaxed and has been eased for them, so that they can come out. Some people are actually been traveling to other provinces that have been stuck here since the lockdown began about 5 weeks ago. Let's speak to more people. Let's speak to you, Ceci. Stele, just talk to us about how do you feel about the regulation actually been relaxed?
Actually, I'm not happy, which means the sickness would increase. The virus will just spread. So I'm not happy actually.
Okay, fantastic. Let's speak to more people. Come to me, Ceci. Let's just talk to you. Let's try to practice some social distancing also. Talk to me about how do you feel about the regulation being eased? I see you are in town. What are you doing here in town today?
I'm working at Spa as a cashier. I'm not happy about this because people are not following the rules. Latitolo kuyagcwala and abantu abafollow kulandela umthetho bayamemana njengathi nemakesha sinebantwana emakhaya sithatha lesipho sihamba naso emakhaya lamateksini kuyagcwala. I'm not happy.
There you have it, Peter. Actually, most people concerned about their health, because this lady says to us that she actually one of the cashiers at one of the stores. But I saw they are concerned because there are a lot of people coming into these stores, and also no social distancing is being observed. That's what we're getting from the people here. Peter?
All right, Tumelo, that's where we're going to leave it. Thanks very much indeed. That's our reporter, Tumelo Machocho, who's in Mbombela, and it's a normal day, but it is the end of the month, and people have a little bit of money, so they're busy shopping today. We'll see during the course of the week what happens in our provinces, but a general concern coming through. A lot of people not happy with the relaxation of the regulations, fearing, of course, this spike in the spread of COVID-19. When we return, we continue with our discussions with the Limpopo Health MEC, Dr. Phophi Ramathuba. Stay with us for that. Welcome back. We're starting to wrap things up here on Health Talk, but we got one more province to visit. And by yesterday, Limpopo province had recorded 32 cases of COVID-19 with 2 deaths. And screening and testing campaigns are continuing there. And speaking to us on this issue around COVID-19 in the province, we're now joined by the province's health MEC, Dr. Phophi Ramathuba. Thanks so much indeed for joining us, MEC. It's partly, I suppose, as some of the successes of your interventions that Limpopo is one of the provinces that hasn't been badly hit so far, even though 2 people have died and we do have those confirmations.
Morning, Peter, and morning to all your viewers there, and thank you for inviting us. Yes, the collective of the people of and led by the Premier himself is up to so far as assisted us, the province, to be able to the number of.
All right, MEC, we've got a problem with the connection and we're going to try and redial you. But in the meantime, I'm going to take a caller just in case that they have a question for you. And on the line, we have... Hello, Gideon, can you hear me?
Yes, I can hear you. Hello, good morning.
Right, okay, we've got your MEC on the line. Do you have a question for the MEC or something that you just want to talk about?
Yes. Thank you for taking my call, and then morning to also the listeners, and good morning to MEC. So, myself, I'm a healthcare worker. I work to one of the hospitals here in Limpopo province, obviously providing the essential services as a requirement. So my frustration has been that now, even under level 4 of the lockdown, I found that I cannot service my car with the car service dealers because when we talk to the car dealers, they're saying even now they're still not allowed to. You cannot drive in your car so that you can get the routine service. But now my problem is that I provide essential services, and therefore I cannot afford to have my car gonna break down. Then it will cause me to affect the services that I need to provide because I use the same car to drive in and to be able to provide the service. So what I was gonna like the MEC maybe also to clarify and help us is that as the lockdown is being eased, can at least maybe the essential service can we be allowed that the routine service of the car, because the car will tell you I should not wait for it to break down, because what the car dealers they are telling us now is that they can only fix when something is broken.
Okay.
But the cars can show me says it needs service, and then we've been using it because it should have got service like since April, but now it's because of the lockdown we could not do it. But can that be eased? At least it will help us, because if it can be serviced, then I'm able also to continue providing the essential service as required with a good car.
All right, okay. We're going to try and get an answer for you from the MEC. I'm not sure how much she can do about changing some of the national regulations, but we'll put that to her. We're trying to get her on the line now. In fact, I think her line is ready. Dr. Ramathuba, and a concerned citizen actually was asking the question. I work in the health services. I think he's a doctor. His name is Gideon. He says, I've got to drive to work to provide this essential service, but his car can't be serviced, and he's scared that his car's going to get damaged beyond what he can afford if he doesn't service it on time. Do you think that there needs to be a bit more thinking about the essential services so that essential workers can actually get to work?
Yes, indeed, we have been discussing those issues, because it's not only him, it's even ourselves, a number of government employees and even non-government employees, but who are rendering essential services and dependent on their cars. And there has been such arrangements which have been made to can be able to get the car to be serviced. So I think what is important is that he must just bring it to the attention of the authorities. Some of the issue is that
the lack of knowledge and understanding on how the rules operate becomes other people being very strict to say you can't do this, whereas you can. I mean, we are even currently at level 4 now, which I think for him to be able to get his car fixed, it should be possible.
All right. And in terms of looking ahead, stage 4, level 4 regulations, we've been getting a sense that some people are worried that lack of compliance is going to escalate the problem. Is that something you're worried about in your province as well?
I think we are indeed worried as a province. When we were on a lockdown, the total lockdown or level 5, as a province, our main focus was to make sure that we do know who is who in the province in terms of the mass screening and testing. We moved from a point of where we had only screened 6,000 people and to an era where we had already screened more than 2.7 million people. We moved from just within an NHLS from testing just 250 to now we have tested more than 2,500. And we're saying as a province where we are seated, we are comfortable to know that in terms of local transmission, we have not suffered that because majority of even the cases that have tested positive are inter-provincial transmission or coming from outside the country. Now we are saying as the regulations are being relaxed, to move to level 4, we must expect a surge. And the question is that as a team now, we need to plan ahead. And planning ahead means what is our readiness? We put the HOD, put the team now. The response team have been spending sleepless nights. Even yesterday, they've been on duty up until almost early hours of the morning to say if today, Peter, we are to have a 5% attack rate, we are definitely ready as a province. We are comfortable. Looking at a population of 6 million, we are just estimating more than what we currently have. If we are looking at 6 million, we are saying 300,000 people will be infected or less. And that we are ready to deal with. When we say 300,000 people must remember that they will not be attacked at the same time. It can be happening different stages. People, some recovering, others not. And let's also remember that 80% people will not necessarily require hospitalization.
Right.
We're saying it will only be 20% with mild to severe. As it is for now, our ICU beds that we are saying are ready to can deal with across the province because we are working as a collective, whether it's public or private.
All right.
We are currently at 54, and those will manage should we have 5%.
All right.
What we have been doing yesterday...
MEC, unfortunately, we have run out of time, but I think we're getting a sense of a province that's battle-ready going forward, and hopefully we'll have an opportunity to chat to you again. MEC Ramathuba, thanks so much indeed for joining us. And thank you at home for joining us. It's been a pleasure having you, and we hope that you've found this informative. Join us next week for the same kind of talk on Health Talk, where we look at the pandemic and other issues. I'm Peter Ndoro. Take care, everyone.